Am I audible?
Yes, you are Aisha.
Good evening to all our present here. This is Yscgctyouth Aisha. I welcome all of you all to the event Illuminar, a small talk about mental health, organized by Vice Service Club GCT. Over to Vice Youth Srinivasan to introduce today's speaker, Ms. Vinita.
Good evening, all. Let us welcome our speaker, Ms. Vinita. Ms. Vinita is an existential approach based psychotherapist currently working as an assistant professor in Satyabama University, Chennai. She is a psychological advisor for many NGOs and has been an active volunteer for psychological services during COVID-19 pandemic. She had handled hundreds of cases during the pandemic and is associated with Government of Tamil Nadu for COVID-19 grief counseling sessions. Her passion is to work in projects which enhances the well-being and efficiency of the individual with self and employment. Now, I hand over the session to Ms. Vanita.
Thank you so much, Srinivasan, for the introduction and for reaching out to me for the webinar as such. So, before I start with the presentation and before we move forward with the talk of complete mental health and lecturing on it, first I would like to excuse I have a bad cold. So, if there is any issue with that, I'm extremely sorry. And the second one is how many of you here think that you yourself or someone that you know of is suffering from mental health issue? Just raise hand. Is there an option in Meet? If there is, I'd like to know how many of you yourself or anybody that you know of in your circle is experiencing any mental health issue. Am I audible?
Yes, ma'am.
Nobody? Nobody here is facing any mental health issue, or nobody, no one that you know of is facing. So this is a very silent session, is it? Okay, Aisha, yes.
Yes, so one of my cousins, like she's a very far relative of mine. She's been facing mental health like for almost 2 years. She's undergoing some medication and all, ma'am.
Okay, good. So I'm happy that you have understood that your cousin is going through something and the cousin is looking for mental health professional help. That's great. So in India, mostly as a country in itself, many of us face mental health issue. By mental health issue, I'm not telling you about the extremes about schizo or bipolar, any kind of extreme disorders, but just the normal ones, depression or anxiety that we go through every day. So a lot of people go through a lot of stuffs in our country as such, but there is very less population that looks for a mental health professional guidance. So that's what we're going to look into today. So I'm not going to lecture on what are the different disorders and how you can identify them. So all those are very extreme stuff that is read by psychology students as such. I'm going to give you a picture about what mental health is and how you can deal with it, if it's just practical tips, and how you can move forward for a professional help. So shall I start with the presentation?
Yes, ma'am.
Is the screen visible?
Yes, ma'am.
So, first we're going to look into what are the contents that we're going to discuss today. So, the contents would be what mental health is and why is it not just about mind, and what are the different other factors that contributes towards the mental health, and on why it is important and how to move forward towards maintaining mental health, and when you should go for seeking professional help. So these are what we're going to discuss for this evening. So let's start with the basics, and before that I'd like to introduce myself. So I think Srini gave a small introduction. I would like to make it very brief. So myself Vinita, and I'm a psychologist, psychotherapist, and existential based therapist, and an assistant professor in the Satyabama University. So I am a part of the mental health professional group that's willing to help youngsters and your family members and all the people who want mental health guidance. So now, what is mental health? So when we talk about mental health as a concept in it, we always look into the different other aspects of mental health, just like how the emotions and how a way a person acts or the way a person behaves in a societal setting, that is only considered to be a part of the mental health. But now the awareness towards mental health is kind of increasing. So before moving on to just looking into the Instagram aspect of mental health, let's look into the proper what mental health is, what is the contributes or what is called as a mental health, and come out of the confusion that it is just about how people behave in a societal setting. So the basic definition or the basic way of expressing or the correct aspect of looking into mental health is a person's mental health is nothing but the emotions, the psychological abilities. The psychological abilities include the motivation, the learning, the behavior, and the social aspects, social interactions of the individual with the people who are not himself. So, by society, we don't mean just the outside aspect, the home in it. The home is the mini society that we live. So the home and the family and the close ones, the secondary settings, which is basically your school or your college or your office that you work in, and then moving on to the extra large, which is the major society. So they are the ones that you meet very occasionally. So these are the three levels of societal settings we are talking about, and the psychological abilities such as the motivational factor on why a person is doing an aspect or why is he avoiding another aspect, the learning aspect, and why are we just sticking to the ones that our parents give us into, or why are we looking into the other aspects, or why are we completely different from other people, the perception, the way of looking into things. So all these are mental health based concepts. And then the emotions, the regular feelings experienced by the individuals are considered as the emotions. So the emotions, the basic emotions are happiness, sadness, anger, frustration. So all these kinds of regular feelings that you encounter on a daily basis are the emotional aspects. So basic mental health, if someone talks about mental health, they mean these three aspects: the emotions that an individual goes through, the psychological abilities like the motivation, the behavior aspects of it, and the social interactions within the family and outside the secondary circle, including the office, college, and the third of the extra large circle, which is basically the society based people, which is basically the ones who you meet once or twice for a particular period. So that is the social interactions. So when somebody or yourself, when you're talking about mental health, do not confuse it with the other aspects, but this is the major mental health aspect of the individual. So when we talk about mental health or the awareness of mental health or any other webinar kind of things that webinar kind of knowledge that we share about, is majorly how you can work on your mental health, or how if you are deteriorating you can help. So mental health as a concept is not necessary to be done only when it is deteriorating or when you have a disorder as such. So it's more than just a state of being without any disorders or without any illness. நம்மளுக்கு தூக்கம் வரலைன்னா மட்டும் நம்ம வந்து மென்டல் ஹெல்த்தை பற்றி யோசிக்கணும்னு இல்லை. In your regular settings in itself, how you can express yourself in a more efficient way, in a more very productive manner. So for all that, mental health is a concept and the awareness of it is very necessary. So you all might know, as human beings, we are comprised of different aspects. So the major ones include, the first one is the physical aspect. The physical aspect is the biological aspect of the individual. How your organs work, how your hormones work, how your um, working of the organs work. So all those include in the physical aspect. The second one is the mental aspect, which is what we are diving into. And the third one is the spiritual aspect. Spiritual aspect refers to how you as an individual are growing, or in what state are you towards giving yourself the growth or the development towards the major aspects of life, or towards understanding yourself, or towards becoming more aware towards yourself. So all these three major aspects should be maintained in balance. So that is the three major aspects of anything. So now we are currently looking into the second aspect, which is the mental aspect. So when we are talking about mental aspects, we talk about depression, anxiety, and we talk about a lot of other disorders as such. But the awareness towards mental health is necessary majorly to look into working or efficiently in your projects, or in your ways of being, or in your awareness, or in your concepts of understanding things. So being very efficient and giving your best towards things is what happens when you focus on your mental health, which will help you balance between the physical aspects of the individual as well as the spiritual aspects of the individual. So, why is it necessary for us to have this mental health awareness? Is because 1 in 5 adults experience mental health concern in the past year, and this is increased tremendously during the pandemic era. So, this pandemic has affected all the aspects of an individual, just the physical, mental, and the spiritual aspects. So that is why, since all these are under rupture, every individual is facing his or her own way of expressing the deterioration in the mental health. So since 1 in 5 adults are experiencing a mental health concern in the past year, it is our responsibility to make us, or to provide ourselves the knowledge about how we can work on ourselves. So 56 million Indians suffer from depression. So we will be looking into what depression is and what anxiety is in the further slides. And 38 million Indians suffer from anxiety disorders. And this is one of the shocking evidences that recently the WHO released, which is basically India accounts for 36.6% of suicides globally, which is almost 37%. And here, all in the global level, India as a subcontinent contributes to 36.6%, is a major concern. And the other statistics that is available is that only 2% of psychology based professionals are available in India for treating the people. So this is another major concern, and that is one of the reasons why such numbers are counted for the depression and the anxiety based sufferings that the individuals are facing. And that's the reason we should give ourselves the knowledge and the awareness about our levels of major aspects of the individual. Okay, so basically, in this presentation, or after this presentation, or the test that you took before the presentation will give you an idea about which state you are in your mental health levels. So here, as you are aware, as you try to understand on which levels you are, or on which level of concentration, attention, or which level of motivation you are, or about your self-esteem, about your self-confidence, the more that you know about yourself, the more you're going to realize your abilities. So the more you understand, this is what I'm capable of, or this is what I can proceed with, or this is what I can express myself with, or work with myself, the first thing that will help you to handle is to cope with your stress level. So every individual experiences stress as a part of their life. So every day we are exposed, even getting up in the morning for some people is experiencing stress. And then moving on about the travel to college or to work is a stress. So everybody experiences a minimum level of stress in their lives. They should experience. So stress is basically a positive aspect according to the psychologist when it is under the controllable levels. So when it moves on to the levels which is not controllable, then it becomes an issue with the individual, which raises to other issues like depression or anxiety. So the more you are aware about yourself, the more you know that where you are lying as an individual, the more you will be able to understand where your stress level is. So when you are getting too tense, so when you understand that, so by taking the mental health based test or by just understanding the major concepts that we are going to discuss further. So when you know that your level of stress is increasing when you are doing a particular activity, either next time you try to avoid doing that activity or you try to control it by giving yourself some exercises or techniques. So the more you're aware about certain things, the more you are prone to understand how to analyze and how to take care of yourself further. So it helps you with coping with the stress, and it helps to increase your work productivity. So basically, when you know how to which level you are in, which level in your work you are in, which level in your college you are in, or with your attention levels how you're standing, so to increase it, you yourself will look for the techniques. The more the awareness, the more prone you are towards the positive side of it. So the positivity will lead you to increase and work on yourself. So that will increase your work productivity. And the more you are as an individual growing and developing as parts of the society, each individual taking care of himself or herself and working on the mental health aspects, you contribute to the society as a whole. So the next thing we are going to get into a little more deep into the mental health disorder aspect of it. Since we have just looked into the positive aspects, be aware of what is happening in the mental health field, and then let's move on to understanding how to cope up with it. So the first thing is the mental health issues affect everyone. So with a survey that was taken, 85% of the respondents agreed that mental health issues can happen to anybody. So the 85% of people are aware that people are prone to mental health issues. So here, mental health issues depends on affecting the individuals varies from their genetic disposition to their societal disposure and to their individual acceptance towards the situation. So all these contributes toward the mental health issues, and it affects in everyone on different levels. So as we were discussing with regards to stress, the same goes with the anxiety and depression. So as we psychologists expect every individual to have a normal anxiety and a normal depression, which is required for them to go forward with the other set of activities in their life. So we for a normal individual, the anxiety and the depression levels are not considered as zero, but there is a range that is acceptable only for normal individuals. So the ones that are lesser than that are also considered as people having mental health issues, and the ones that are considered above than that are also considered having mental health issues. So the mental health issues can affect everyone based on the levels of handling the issues like anxiety and depression. So here, what this survey expresses or tells us is that every individual can be affected by the mental health disorders, but it's upon the individual to handle or to cope forward with that. Okay, so let's look into the intricates of what are the different psychological disorders an individual can face through. So the first one is a depression disorder. So depression disorder refers to any kind of disorders that will put an individual into his lowest energy levels. So when you are almost in a phase where you sleep a lot, or when you are not at all energized to do any kind of activities. For example, earlier if you were passionate about any physical movements like football or cricket, so if you're passionate about any games, but now even though there is an opportunity to play it, if you don't consider, or if you prefer to stay in your bed, then you are almost entering into any kind of depression disorder. So depression disorder refers to any kind of disorders that are result of the lower energy levels of the individual. So second is anxiety disorder. Anxiety disorder is basically any kind of disorder that is a result of higher energy levels. So, for example, anxiety disorder basically leads to palpitations, or the expression of nervousness, or the expression of how you should always be able to, always you are prone to expressing yourself in a very higher manner, like shouting, or like expressing yourself in a very extreme conditions. So in that case, that results in an anxiety disorder. That is basically an expression of the individual in an anxiety disorder. The third one is schizophrenia. So I am hoping many of you would have seen the three movie here of Dhanush and Shruti Hassan. So there, where Dhanush has acted out in a schizophrenic disorder. So he could hear things. He could see people who are not available for other normal individuals. So schizophrenia is basically a group of disorders that is from or due to many hallucinations or delusions of the individual. So hallucinations, there are different varieties of hallucinations like auditory, visual, and delusions. There are different other delusions like delusion of grandeur, and there is a lot of concepts that is under schizophrenia. So schizophrenia and bipolar as such is a very extreme disorder that is resulted due to common, or that is resulted due to a group of disorders. So schizophrenia is any extreme psychological disorder. Bipolar disorder is a combination of the depression and the anxiety disorder. So a person who is experiencing a bipolar disorder will experience both the highs and lows in a psychological circle on different periods. So one day they'll be high energized, so they'll do every activity, they can perform any activity, and they'll be to their extreme. So they cannot even sleep, they do activities continuously. Whereas after some time, they are continuously in their bed. They are in low energy to an extreme. I cannot say that this will happen one day of high energy and one day of low energy. It doesn't happen that way. It depends on the individual as such. So for a phase of time, they'll experience high levels or high variance of energy. And for a different phase of level, they experience low variance of energy. So these common psychological disorders, again, whatever I explained right now, is just the symptoms of it, and as psychologists we only can tell you that if this is happening with you or not, because there is again a time frame in which these symptoms should sustain, and according to the individual it varies. So there is something called a DSM criteria that we psychologists follow. So according to it, each disorder is given a particular time frame. For example, in a depression disorder, if you experience it for more than 2 weeks to 1 month, then you are prone to a depression disorder. So one day, if you're going to just stay in bed for the whole day, and if you're going to perceive it as a depression disorder, then you're completely wrong. So every individual needs one day of break. So that is a break and not a disorder. So this you will have to be aware of. So do not come to a conclusion to any of these disorders. This is just for your awareness to know or to identify if you are going through. But for a confirmation, you have to look into a psychological professional. So next, the concept that we were talking about, when do I seek a professional help? So if you face any of the particular symptoms that is expressed in this presentation for a certain amount of time, then you can look for a professional help. So the first one is eating or sleeping too little or too much. So I'm hoping you all remember about the different major concepts or major aspects of the individual that we were talking. So first one was the physical aspect, the second one the mental, and the third one the spiritual. So if any of the other aspects is disturbed, one of the aspect expresses it. Majorly, when your mental and your spiritual aspects are disturbed, Your physical aspect is the first thing that will express to you that something is wrong inside you. So basically, mentally, if you're not feeling good about yourself, or if your psychological abilities are not functioning properly, or your emotional expressions are not as appropriate to the societal norms, and the way you interact with people is not right, then your physical levels like eating or sleeping will be disturbed. So the every body is connected to your mind. So when your mind is disturbed, the mind tries to express it in one of the forms, but it is majorly not noticed by the individuals, and thus the body expresses it through the digestive system or through your relaxation system. And this basically happens because the mind, being the controller of the body, affects the hormonal levels of the individual. When the hormonal levels of the individual is affected, it results in the disturbance in the digestive system and in the relaxation system. So the first thing that gets disturbed is the eating. So you either feel very much, you don't feel like eating at all, or you eat a lot than what you usually require of. So that kind of any symptoms that you experience. Or the sleeping, either you sleep too much or you're not able to sleep at all, then eating or sleeping too much is a symptom that is expressed by the physical body. Second one is having low energy. So any variant in the energy level that you face through amongst a particular period of time is one of the symptoms. Third one is feeling unusually confused, on edge, or scared. So very nervous about anything or every decision that you take forward, or you're very confused about how things will go through even though you have a plan. And always on the edge means always being very difficult to focus on things, or very on the aspect of thinking like on the wall, not deciding on what you want to move forward with. So those kind of symptoms that is expressed mentally. The fourth one is hearing voices or believing things that are untrue. So this is according to the societal norms. If you're not able to act, or if you're hearing any kind of voices in your head, then it's one of the symptoms. The fifth one is inability to perform the daily task. So the daily task includes your waking up, eating. If you are a person who includes movement and able to perform the tasks that you do, and able to sleep. So these are the basic elements of a day that every individual goes through. So if you are not able to perform any kind of activities, even waking up becomes very difficult. And nowadays waking up is difficult for everyone, but still that extreme levels of inability to wake up and not able to eat, not able to perform the activity that you regularly do. If you always would have been so happy to be a part of a project or to meet your friends, but suddenly those all doesn't feel good to you, then in that case, for a certain period of time that you are going through these symptoms, then you have to look for a professional help. And how to maintain a positive mental health. So this is especially for the ones who feel like you are in a moderate level of mental health and you need some help to push forward for the effectiveness and the productivity. So if you are someone who goes through the symptoms that we discussed about for about a period from 2 weeks to 1 month, I request you to meet or look for a professional help immediately. The ones that are not, or are feels like you're at a moderate level, or you have took any mental health test to identify that you are in a moderate, and that identifies you to be a moderate mental health individual, then you can use the following techniques. So the first one basically is to acknowledge your feelings. So this is where majorly as the Indian citizens or the cultural aspect of it, we lag in. We do not accept that we are going through something because of the taboo that we have towards the mental health disorders. So it's very, very, very important for you to acknowledge your feelings, to acknowledge that you're going through something worse, or to acknowledge that you are going through some aspects that are not good for you. And second one is connect with others. So either look or tell to your friend or to your family members, or directly to a professional help. So the third one is extremely good, but the first two ones, friends and the family, will give their support to you. So these two are very important even if you are in a moderate level of mental health. So as we were talking, so the mental health and the physical aspect goes to side by side. So as you increase, so when the mental health deteriorates, the physical health expresses. The same way, when the physical health is increased, then the mental health will also combine and it will come to a moderate level. So the ones who are in the moderate mental health state, working on a movemental aspect will help you to work on your mental health aspects. So the ones who work out for 30 to 45 minutes are found to have better mental health conditions than the ones who do not. So that basically leads on the scientific data that the more you exercise, the more the dopamine and the serotonin levels in the individuals increases. Thus, it will lead to working on your mental health conditions, because the dopamine and the serotonin are considered as the happy hormones. So when your relaxation hormone and the high energy level hormone is secreted well, your body goes back to the cycle. So this is basically where your machine gets repaired, but again you pour some oil to come back to the normal state that it has to function. So that's what exercises does to you. Next is developing the coping skills. So what are some of the skills that is required by the individual to move forward or to increase your efficiency towards doing certain things? So the first one is take a deep breath and relax. So as we were talking earlier, so you know where which activity increases your stress levels. So basically, if getting stuck in a traffic is increasing your stress level, then just sitting in your vehicle and taking a deep breath and relaxing yourself will help you to handle the stress that you're going to get in your workplace. So just accumulating the traffic stress and work on increasing it with the work stress and increasing it with the relationship stress is going to lead you to any kind of disorders. So handling those stress that happens at that time and taking a deep breath and relaxing will help you to forget or to take away that particular stress. So when you're having a stress that when you are traveling to somewhere or when you're stuck in traffic and it's just 2 minutes for you to enter into the college, or else your professor going to mark you absent, then in that case, if you're going to increase the stress just staying in the traffic in itself, and even then if you get an absent from your professor, it's going to add on to the stress level. So instead of that, just staying when you are in the traffic, just taking 2 or 3 deep breaths and relaxing, saying that however, even if I'm going to be late, I'm going to handle it. So acknowledging that feeling and relaxing yourself is going to make things more easier to handle than making it difficult. The second one is embracing the 5 senses. So this majorly works with anxiety-based disorders, where in anxiety-based disorders, you do not feel like you are staying with yourself or you are not connected with yourself. So in those cases, you can embrace those 5 senses, basically the visual, auditory, tactile senses. So embracing these and feeling present in the moment will help you to cope with the skills. The third one is be in touch with your thoughts and feelings. So this coping skill majorly refers to the writing down your feelings, either in your phones or in a paper, just expressing your feelings and thoughts and expressing gratitude towards the things that you have currently. So this coping skill will help you again to ground yourself to what the present moment is and to acknowledge it and to work on it. So these are the 3 important coping skills that you can develop in order to stay in the ground and understand what you're going through and to increase or develop yourself to a better individual. So with regards to mental health problems, there are different kinds of therapies or treatments that is available. The first one is the inpatient treatment, which basically means the hospital, in a hospital setting, you're being admitted and you're being taken care of. This happens for extreme cases like schizo, bipolar, or addictive disorders. Second one is alternative care. Alternative care is basically any other kind of help that can add on towards your mental health development is basic acupuncture or EFT programs or any other NLP programs. All those comes under the alternative care. Prescription medication is basically you going to a going to a professional help, and then they providing you medications. So when they provide you medications and that seductives helps you to calm yourself to come to a center state is prescribing prescription medication. The fourth is counseling or therapy. So this is majorly done by the psychologist. So here we counsel and we understand your feelings and we help you understand on what levels you are, and then providing the therapy based on the problem that you are facing. And the fifth one is a support group. Support group is basically, you would have heard about the alcohol support group or the parental support group. So all these support groups are majorly set of people who have a common issue. They come together and they talk about their feelings, thus making sure that each individual feels like he or she is not going through the same thing. So these are the 5 different sets of holistic healing that one person can try for any mental health issues that he or she is going through. And finally, don't hesitate to seek any professional help, even if the issue feels like a minor or if the issue feels like extremely major. Do look for the help. Each psychology based professional help will help you or will lead you to develop yourself as an individual. So whenever you feel like you are going through something towards extremes, or even when it is moderate, each individual is different. Each individual expresses it differently. Maybe you are mentally going through something extreme, but your expression is very moderate. So do not come to a conclusion with just the help of Google. So look into for a professional help, and they will help you and develop you as an individual for the betterment of yourself as well as for the society. So that's it from myself. So if you have any questions, we can move forward. Is there any questions?
Ma'am, I have one question, ma'am.
Yes.
How to overcome that depression, ma'am? Like many of us is forcing for the suicide, like thinking, ma'am. How to overcome that one, ma'am?
So when you are going through depression, so if you feel like you're going through depression, that just because of the symptoms that I mentioned or that you heard of from Google or from any other books, I would request you to go to a professional help, basically, because that will help you to realize where you are standing. And there, the major things that you would do is basically take a test and to identify in which levels you are. By test, I mean the paper pen analysis that we do, and further which you can move forward to understanding on what aspect is leading you to this depression, and then working on it. So this is how we can prevent suicidal thoughts. But as individuals, if you feel like you're moderately experiencing depression, the coping skills that we discussed right now will help you in an higher levels.
Okay, ma'am. Thank you, ma'am.
Any other questions?
No, ma'am, I have one question, ma'am.
Yes, Sri.
How to stop overthinking, ma'am?
Okay, so overthinking is basically a result of extreme anxiety that you have towards things. So I don't want to put into the term of anxiety. Let me just put it as fear. Okay, so if I was doing this a kind of seminars for the first time, then I will be in extreme fear of public speaking before like 100 participants in the seminar. So I would be very terrified of understanding or knowing that I am going to sit before the 100 people and talk about something, then in that case the overthinking happens, saying what if current goes off, or what if my lab shuts down, or what if my headphones are not working, what if they are not able to see me, what if the PPT is not relevant to the topic that they told me. So all these kinds of overthinking happens in my head as a result of fear. So the important thing that you can do to avoid overthinking is to acknowledge that you have a fear. Yes, I am fearful to face this 100 participants. Then what can I do? So then how to handle, or what betterment can I do? So if the lab gets shut down, I have a backup. Then if the headphones is not working, then I look for another backup, and or I can connect from my mobile. So looking for the backups and different other options happens only when you are not acknowledging what you are going through. Okay, so when overthinking is a result of fear, so instead of looking it as a negative aspect, consider it as a positive thing that's leading you to the development. So if you do not have a fear of this getting things into failure, then you will not even think about the backups, or if there is other situation that's going to destroy your complete day in itself. So fear is a good thing only when it is acknowledged, and it will not lead to overthinking, which is a negative aspect, because and you work on your fear will help you control your overthinking.
Okay, ma'am. Thank you, ma'am.
Yes, and I think we have some questions in the chat. And Ratina Bhupati has asked, how much does music influence our mental health? What kind of music will be useful in what kind of situation? Okay, so of course, music helps influences your thought process, and basically, it's because our brain works in alpha, beta, gamma waves. So these wave signals are in certain aspects, and if I'm thinking, if I'm sleeping, there is a wave structure, and if I'm awake, there is a wave structure, and if I'm extremely awake, like for now, I'm completely focused on this presentation, then it is at particular signal level, wave signal level, and it's completely physics. So, music is also a particular wave system. So, for a calming music, there is a particular wave system, and for the good or the very fast music that you will look into, that is of particular wave system. So, when you're stressed, I would recommend you to listen to calm music. So, for example, in YouTube's we have certain music that says this. When you listen to this, you'll get into the sleep. That's basically those music has a alpha wave system, alpha wave signals that will lead your brain to calm down. Okay, so music does influence your brain operations, and the more the calmer the music, the more you are able to handle your stress levels. So whenever you feel like you are too much into a stressful situation, listen to calm music. And whenever you feel like you need energy, say example, in gyms you always find fast music, whereas in a yoga session you always find calmer music. So these kind of music helps you to the calmer music helps in a stressful situation, and a fast music helps you in a movement based situation. Okay, so Logavani has asked, ma'am, how to control anger and also how to overcome mood swings. And for with regards to mood swings, there is gender aspects to it, because as female, every month we go through a change within ourselves during our menstrual cycles. So in that case, our hormonal levels varies every month. So in that particular period of time, we are more prone to mood swings. So if you are a person who is experiencing mood swings because of the period aspect of it, then it is nothing to be worried of. But if you are experiencing mood swings even during your regular days, then it is something to be considered, because it is a fluctuations of the hormonal levels. Again, physical aspects like PCOD, and if you have any thyroid, of if you are experiencing thyroid, then you will then that is a cause for the mood swings aspect. So that is all to be considered, and that is why I'm saying every individual is different, and every individual case has to be studied to tell you how to overcome it. With regards to anger, again, anger is an expression of fear. So acknowledging the fear and working on it and finding the alternatives and considering a solution or coming to a solution for it will help you overcome the anger. And Sudha has a question. Currently, all youngsters told they are in depression. I think they don't know what exactly depression is. How to handle that situation, ma'am? If anyone comes to say that he or she is in depression. Yes, as you were saying, the depression, anxiety, OCD, all are becoming very fashionable terms with regards to how we talk in a conversation. And I think that is also one of the aspects that's leading to the awareness of it. And with regards to handling depression, or handling a situation where a person is in depression, is to identify what it's leading, what is the cause of it, if it is because of the growth aspect or if it is because of the current situation aspect of it. So anything that is leading to it should be identified, acknowledged, and worked on. So this is how depression also works with. And again, depression is the cause majorly because of the accumulated feelings of the individual, accumulated situations of the individual. So we have to identify and we have to separate each and then work on it. So that's how we can work on depression also. And Aisha has asked, ma'am, will women have mental health problems during menopause? If so, how can we handle it, ma'am? Yes, women will be on the path to extreme mental health disorders, on the way to extreme mental health disorders during their menopause, because menopause is a phase where all the accumulated feelings, accumulated psychological effects of the women, especially during their uh, pregnancy and the delivery, is continuously accumulated, and the different stress levels that they experience as individuals is expressed, is in a full effect during the menopause. So yes, every women will experience extreme psychological disorders during menopause. Again, it depends on the individual, on how they cope it, on how they perceive it, and how they handle it. So if it is on moderate levels, if you feel like the women is acting in a moderate level, then you can use the develop coping skills that we discussed, or if it is to the extreme, you should go for psychological help. Yes, and how to overcome laziness in the pandemic situation. I thought that makes me depressed. Okay, so laziness is again, which is very common experience in a COVID pandemic situation, and according to me, it's not a mistake, or it's not a form of a disturbance to your livelihood, because pandemic is not something that we have experienced on a regular basis. We are exposed to this situation for the first time, and every individual takes his or her own time to overcome it. So we have to give that particular time for the particular individual to handle it and to overcome it. So if you are a person who is overcoming it through the laziness, or if you are using laziness as the rest value for pandemic, then it's completely okay. But if you're not able to come out of it, or if you're not resilient enough to come out of it, then that's where the problem is. So and give yourself some time to be lazy enough. Maybe this week you can be lazy, or this day of the week you can be lazy, and then overcoming and doing your regular activities. If you're able to do that, then it's completely okay. But if not, if you're not able to even perform your daily activities, then work on the coping skills that I recommended, or look for a psychological help. Okay, so I had a friend in our
Ma'am,
yes,
there are
yes,
few questions from YouTube live chat, ma'am. I
yes.
posted in the chat, ma'am.
Okay, shall I read it, or will you?
Ma'am, you it's a afraid, ma'am.
Okay. I had a friend in our department who was seemingly normal to us all, but he suicided in the last year December, writing down on a paper that he was depressed. How to find that someone is depressed even if they are pretending to be fine? This is a very sensitive question, and I'm extremely sorry for your loss. Moving forward on how to identify if someone is going through something even when they express themselves or pretending to be fine, is basically, we as individuals, we live in a social setting, So we are social beings. So we live amongst other individuals. So in that case, a person who's taking the decision of suicide will have expressed in one way or the other that he or she is going through something. So we as individuals should provide our attention to it. And when someone says I'm not feeling good, or when someone says that I don't like, or I am not satisfied with myself, or I don't want to live, every 100 people in the meeting, I request you to give attention to those kind of words. And in this case, where one person is depressed, and if he hasn't expressed it to you, just identify on those activities. So one way or the other, we would know that they are upset. But every time we cannot go and ask to a friend saying என்ன ஒரு மாதிரி இருக்க என்னாச்சு ஏதாச்சும் சொல்லு அப்படின்னு ஒவ்வொரு வாட்டியும் கேட்க முடியாது. ஸோ அந்த டைம்ல just be with them. I'm not saying start giving advices or start take them to the psychologist. At least saying that one person is willing to support them, or one person is willing to be with them, that will help the individual to understand that they are valued, and understand that they are heard and they are seen. So just support them by just being there for himself or herself. And not even words require words are not necessary for them to understand that you are there. Just being with them as the way they expect you to. And when you feel like things are extreme, even if they are not willing, do push them to get a professional help, or do provide them the opportunity to get a professional help. And Kaushika has asked, எண்ணம் போல் வாழ்க்கைன்னு சொல்றாங்கல்ல, எண்ணம் மாதிரி லைஃப் மாறும்னு சொல்றாங்க, அது சயின்டிஃபிக்கா நீங்க எப்படி பாக்குறீங்க? ஓகே, ஸோ ஆஸ் வி வேர் டிஸ்கசிங், ஸோ மென்டல் ஹெல்த்ன்றப்போ நம்ம வந்து தாட்ஸ், இமோஷன்ஸ் இல்லை, இது எல்லாமே தான். ஸோ எண்ணம் போல் வாழ்க்கைன்றது வந்து தாட்ஸ் ஆக்ட் ஆஸ் அ பேஸ். அதுதான் வந்து நம்மளுக்கு வந்து எல்லாத்தையுமே நம்மள புஷ் பண்றது. ஸோ இப்போ நீங்க நினைக்கிறது, இப்போ நான் வந்து ப்ரொஃபஸரா ஆகணும்னு நான் நினைச்சேன்னா ஐ ஹாவ் டு ஒர்க் டு இட். அதுக்கான விஷயங்கள்ல நான் வந்து என்னை வந்து ஈடுபடுத்திக்கணும். ஸோ அந்த மாதிரி ஸோ ஒரு தாட் கேன் டிஃபைன் எனி திங் அண்ட் எவ்ரி திங். ஸோ இஃப் யூ ஃபீல் லைக் நீங்க வந்து கண்டினியூஸா உங்களுக்கே வந்து இப்போ ஃபார் எக்ஸாம்பிள் சைக்கலாஜிக்கலி நாங்க என்ன சொல்லுவோம்னா இஎஃப்டின்னு ஒரு டெக்னிக் இருக்கு. இப்ப நான் எதையே திருப்பி 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 சொல்றேனோ அதை என் சப்கான்சியஸ் மைண்ட் எடுத்துக்கும். இப்ப சப்கான்சியஸ் மைண்ட் வந்து இஸ் எ வெரி ஃபர்டைல் சாயில். இப்ப நான் அதுல வந்து நல்ல விதையை போட்டாலும் அது மரமா வரும், கெட்ட விதையை போட்டாலும் அது மரமா வரும். அது வந்து இது நல்ல விதை, இதை மட்டும்தான் நம்ம விதைக்கணும், கெட்ட விதை அது நம்ம எடுக்க கூடாது அப்படின்லாம் அது யோசிக்க தெரியாது. ஸோ இந்த சப்கான்சியஸ் மைண்ட்ல வந்து நம்ம எதை விதைக்கிறோமோ, எந்த தாட்டை விதைக்கிறோமோ அந்த தாட் வந்து பெருசா வளரும். ஸோ இப்ப நான் வந்து ஐம் ஸ்ட்ராங் அப்படிங்கறத நான் ரிப்பீட் பண்ணி சொல்லிட்டே இருந்தேன்னா அது ஒன் ஆஃப் த டெக்னிக் நாங்க சைக்காலஜில யூஸ் பண்றது. ஸோ இப்போ ஐம் ஸ்ட்ராங் ஐம் ஸ்ட்ராங் ஐம் ஸ்ட்ராங் ஐம் ஸ்ட்ராங் அப்படின்னு ஒரு நான் 3 வாட்டி 4 வாட்டி சொன்னேன்னா அதுவே என் சப்கான்சியஸ் மைண்ட்ல போயிட்டு நான் எப்பெல்லாம் ஃபியர்ஃபுல்லா இருக்கணும் அப்போ அந்த தாட் வந்து ரெப்ளிகாவா ஆகும். அந்த தாட் வந்து ட்வைஸ் த டைம் என்னை வந்து ஃபார்வர்டா கொண்டு போகும். நான் என்ன பண்ணணும்னு நினைக்கிறேனோ அதுக்கு என்ன தூண்டுதலா இருக்கும். ஸோ அஃப்கோர்ஸ் எண்ணம் போல் வாழ்க்கை வந்து scientifically is extremely correct because your subconscious mind is a fertile soil, and whatever thoughts you are is going to grow twice the time, twice, thrice, or it depends on the individual again. So how strong your thought is, that strong your ability is going to increase. So Logavani has mentioned, sometimes I feel alone, thinking no one is for me and people are going away from me, over depressed and showing anger to other people. How to face these kind of situations now? How to be normal? Again, being normal is not the aim. Being normal is just a phase. So every individual need not be normal every time. Every individual need not be angry or depressed every time. It's just a phase. So now whatever you're going through can be a phase, but I request you to move forward and take a psychological help with a proper psychologist or a psychiatrist and understand on what is the issue that you are going to face through. So, since you have said that there's no one for me and people are going away from me, it all feels like you are to your extreme. So, in that case, please do look for a psychology help, any kind of professional help, and understand where you are lying, and to develop yourself from that is nothing wrong. If you're not able to afford, there are a lot of psychologists who are giving very lesser fee, so you can try with them also. And again, I tell you, normal is just a phase. நம்ம கோமாவும் இருக்கணும், நார்மலாகவும் இருக்கணும், சேடாகவும் இருக்கணும், எல்லாமே இருக்கணும், எல்லா எமோஷன்ஸுமே நம்மளுக்கு இருக்கணும். So, as a human being, normal is just a phase. Do not push yourself to be normal. And normal is not a good thing also. Every time you cannot be normal. You have to be happy about something. You have to be sad about something. So, if this is a phase that you're going through for a longer time, please do look for professional help. Certain times, some thoughts strike us like just go anywhere where people can't find you. Just end my life when I'm stuck in any problems. After some time, I'll be normal. How to avoid certain thoughts, ma'am? So again, for these kind of thoughts, you have to understand the why for it. So is it happening due to something that's happening in your physical reasons, like if you're having other physical disorders, or in case if it's happening because of you're not performing well in your college, if you're not able to find a job, or if you're not able to find relationships or very meaningful relationships, then these might be the reason on why you are feeling to move away or to put yourself in a cave, which basically is an impossible thing, because we are social beings. So we want to be connected with people. We want to feel valued. We want to feel heard. So in those cases, you have to understand the reason behind why you're feeling such a way. If it is because of something that you're not able to perform, or if you're not able to find meaning to it, it again is just for this time frame. For this 2 months or 6 months, you might feel this way, but in a 6 month, you might find an extremely passionate job or extremely meaningful and a very romantic relationship. So, after the 6 months, if you take a sudden decision, now in this, based on the present situation, if you're going to take this decision, you're going to miss something that's going to happen very meaningful after your 6 months. So just consider this to be something that you're going through because of the reason in it, and work on that reason. Understand why you're feeling depressed and then work on that. So if you're not able to do this alone for yourself, then ask for a professional help. Okay, so Vigneshwaran has asked, scientists says over 60,000 thoughts passes through over a mind a day. In that, how to differentiate a good thought and a bad thought? Why do you want to differentiate a thought into good or bad, or why do you want to say that this is positive for me or is it negative for me? Why is it basically necessary? Only the thoughts that is happening repetitively in you is going to affect you. So these repetitive thoughts that's happening in you, identify those thoughts and then work on that thought and mostly change it into positive ones. So that is very much necessary. But you as an individual, you yourself will not know what those 60,000 thoughts are. So in that case, identifying it as good or bad and then working on it is really impossible. So the ones that you are telling to yourself repeatedly, or the ones that is in your conscious level, work on them, because these are the repetitive thoughts is happening. So if you feel like, if you continuously feel like you're saying, I'm not worth it, then you have to work on its saying and change it to a completely positive one saying, I'm worth it. So the more you change it positively and the more you put it in your subconscious mind, the more it is going to affect on it. So you cannot monitor all the 60,000 thoughts or classify it into a good or a bad one. Instead, you can work on the repetitive ones that is deteriorating or not leading you to develop. So that's all that you can do as individuals. Okay, questions with the chats. Anybody else? Any other questions? It's 6:37, Srini. Is it okay to take other questions, or how do we proceed?
No, ma'am, there are no questions, ma'am. We can finish.
Okay,
Yes.
done. So thank you all for listening to the presentation, as well as to come forward to know about what mental health is and what mental health awareness is. So thank you so much to UClub for organizing it and for giving me the opportunity to talk amongst the 100 participants and to give away